Back in Southland again to have a look at the Southland Hospital's emergency department, meet an emergency department doctor and see how they work.
My name's Martin Watts. I'm an emergency medicine specialist here at Southland Hospital in the emergency department. The most fun part about the job really is the unpredictability. You never know what you're going to get when you come to work. So the most common injuries we get are minor injuries, you know, hand, finger, wrist and ankle, people with minor trauma having fallen over or cut themselves or being playing sport and injured themselves in that way. When people think about coming to the emergency department, they've got to ask themselves, is this really an emergency? You know, I mean, we do get a lot of people who turn up and say, well, you know, I've been like this for a week, 2 weeks, 3 months even, or even longer sometimes. And that's probably not appropriate for us. It's not really in our skill set, and it's much better managed by a general practitioner who can follow somebody through a longer process. We are much better at dealing with the acute emergencies, illnesses and injuries. The first time they arrive in the emergency department, they get triage. That's the triage nurse, and that's really just a quick eyeball, and they look at them and say, is this patient critically ill or sick or likely to get really ill or even die? And if so, they get straight through into the department. Otherwise, they get a brief assessment at triage, and that's really aimed at sorting people out so that we see the most acute patients, the sickest patients first. And then it's not who arrives first, it's who's the sickest that gets seen first. Now, if I was waiting a long time, that would suggest to me the triage assessment is that I'm not that sick, which is probably quite reassuring, to be honest. We don't try to keep people waiting, but it's a case of assigning our resources so that they're used most appropriately for the sickest or the illest people. I think it's difficult to define an emergency because emergencies are mean different things to different people, and if people are worried, they should clearly come to the emergency department, but the department will get clogged up if we get people turning up who aren't emergencies, who are coming for routine care. Now, the busy nights that we get are often if there's a big sporting event going on, Friday and Saturday night, Thursday night to a lesser extent, where people are out partying late into the night and lots of alcohol involved, and that's often carnage. A lot of people say, how can you work in that stressful, you know, an unstructured environment? I'm actually very used to it, and I find the emergency department working in here, it's actually very easy for me. It's actually, to some extent, that unstructured environment, it's fine, it's easy. It's what is even more difficult is working outside of the hospital, which we do occasionally. And you know, I have in the past, you know, been out to the scene of accidents and so forth, and transported people in the backs of ambulances. That's, for me, is now a much more challenging environment than an environment here. Every day is different. One of the beauties of working in an emergency department is when somebody said, what's your average day like? Well, there's no such thing, because you know, your shift can start. We work shift work. Shift can start in the morning, it can start in the late afternoon or the evening, and it can start late into the night. So there's no such thing as an average day, and an average day can turn into a very unaverage day very, very quickly with just one phone call or just one patient coming in, and that's the beauty of it. You just do not know. It's like Forrest Gump with the box of chocolates. You just don't know what you're going to get. On average, well, we see 34,000 patients a year. Now that's difficult to visualise, but for us a quiet day would be 80 or 90 patients coming through the door. A busy day would be 110, 120, and our busiest days we're looking at 140 or so. And they are really busy and really hard work for the staff involved. We've built up a fantastic, brilliant team over the last few years, and to be honest, my job is so much easier now because of the team. It's great, it's lovely.